We're caring for 575 COVID patients across our 10 Illinois hospitals and 385 across our 16 Wisconsin hospitals. Notably, we've recently surpassed more than 15,000 patient discharges since the beginning of the pandemic. And our clinical teams are taking great comfort in every single time they can reunite a patient with their families. Next slide. As you can see, most of the patients are in our biggest hospitals, including Advocate Christ Medical Center in Oak Lawn, Illinois, Advocate Lutheran General in Park Ridge, Illinois, and Aurora St. Luke's Medical Center in Milwaukee. But the impact is felt everywhere, including our more rural hospitals in Wisconsin. We're also caring for 807 patients through our home care program, in which patients are treated by advanced practice and virtual health nurses and can receive oxygen and remote health monitoring equipment to help them safely recover at home. The good news is our total numbers are down just a little bit over the last 2 weeks, but we're prepared for that inpatient census to start climbing again. We expect to see more patients as the weather gets colder and more people are coming inside together, and as people get sick following the Thanksgiving gatherings. It's with this in mind that I want to make one more comment in my opening remarks. We have more holidays coming up here in the next few weeks, and we are very concerned that those gatherings will generate more cases of COVID-19. Just like with Thanksgiving, we're encouraging people to avoid in-person gatherings for Christmas, Hanukkah, Kwanzaa, New Year's, and other holidays. I know this is a hard thing to hear. I know it's been a difficult year for everyone, but it's going to be especially difficult for our team members and their families if people gather for the holidays. Our doctors and nurses are making big sacrifices too, and we're strongly urging you to think of them and your own loved ones as you make your holiday gatherings virtual this year. Thank you.
Thank you, Dr. Stuck. And now, Dr. Iroegbu, I know you have a few thoughts to share.
Yes, thank you, Leanne, and thank you, Dr. Stock. I wanted to talk a little bit more about the frontline staff that Dr. Stock mentioned, our physicians, our nurses aides, advanced practice clinicians, and others who've been very deeply involved in the care of COVID patients during this pandemic. Many are dealing with the effects of chronic stress, feelings of exhaustion, grief, anger, anxiety, depression, and in some cases, burnout. They've hung in there, and I'm really impressed with how well many of them have done, despite all the challenges that they face. But they are strained, and I think it's important that we recognize that. As an organization, we've been very focused on making sure that we provide the support that our team members and clinicians need. And this has involved engaging additional staffing resources through agency nurses or looking to volunteers to help shore up our staffing. We've also engaged our mission and spiritual care services, as well as other support services, to make sure that our clinicians and team members have what they need to be able to continue to go on. We've offered family care subsidies and other avenues, such as respite rooms at many of our facilities to help to support our team members. You may have also heard about the special recognition bonus that our CEO, Jim Scuggsburg, announced just recently, which is designed to show our team members that we appreciate all that they've done through this pandemic. And all of this is happening while we've also been focused on taking care of our patients who seek care from us for non-COVID related reasons. It's important to remind everyone of the need to continue to manage chronic conditions and to seek emergency care when necessary. We make this possible by our Safe Care Promise, which involves enhanced cleaning, masking, screening of patients, emphasizing social distancing, the use of virtual check-ins, and other such measures. We feel the hospitals are a very safe environment, and it is important that our patients who need care from us continue to seek care in the right way and in the right time.
Thank you, Dr. Iroegbu. Before we get to Dr. Citronberg, just a quick reminder to please remain on mute so that we don't interrupt our speakers. But next we'll go to Dr. Citronberg.
Good morning, everyone. This is a very important day in the progression of our COVID-19 pandemic. We must understand first that we are seeing record numbers of cases and deaths in this country. Yesterday, over 3,100 deaths were reported in the United States. At the current pace, later this week, we will surpass 300,000 deaths from this disease in the United States, which is almost an unimaginable number. We are continuing to diligently push forward to take care of all of our patients in our communities. Today, however, it is anticipated that FDA will approve Pfizer's COVID-19 vaccine under emergency use authorization. This is an incredible landmark. The fact that this vaccine was able to be developed in such a short period of time is one of the great scientific achievements of our time. The vaccine is incredibly effective, preventing COVID in about 95% of people who receive the vaccine. It is not without side effects. Side effects are expected with vaccines, but there is no doubt that the benefits of the vaccine far outweigh the risk. And this is the message that we are sending to our team members and to our community. Mass vaccination is our only way out of this pandemic. It is the ticket out, and it's really the only way right now that we can get out of it. We expect over the next several months, we're going to start to roll out vaccine as soon as next week, but over the next several months, be able to immunize all of our team members who want vaccination, and then everyone in the general population who wants a vaccine. We think this process is going to take about 6 months to be able to provide a vaccine to everyone in this country who wants one. But this is how we get out of the pandemic. This is the message that we are getting across to our team members and to our communities, the importance of mass vaccination. So as we have more information about when we'll be receiving vaccine and how much vaccine we'll be getting into what sites within our system, we will pass that message along.
Thank you, Dr. Citronberg. Now we're going to go to the Q&A portion of this. Several of you submitted questions in advance. We really appreciate that. So we're going to start with those. And if you think of any questions, feel free to throw those into the Zoom group chat. Our team is monitoring those, and we'll get to those when we can. But we're going to start with some of the ones that we were asked in advance. And we have quite a few people asking about vaccines, no surprise, specifically about vaccine shipments, when they're coming in, both to each state, Illinois and Wisconsin, and individual hospitals. Also kind of when the general public can expect to start getting vaccinated and what the timeline is. So Dr. Citronberg, I know you're pretty knowledgeable on that. So if you kind of wanted to take that one.
Sure. You know, we're dealing with 2 states, Illinois and Wisconsin, both of which have somewhat different frameworks for distributing vaccine. We're working very closely with both the state health departments and local health departments in both states to determine how much vaccine we'll be getting and when we'll be getting it. We don't have any final numbers on that right now, but we have been working diligently in our COVID vaccine steering committee over the last couple of months. We are prepared for really any amount of vaccine that comes in any state. We are in the process of prioritizing our team members to receive a vaccine at this time. So when the vaccine is available, which we anticipate to be sometime next week, we will be ready to go. We'll start immunizing our team members.
Thanks, Dr. Citronberg. In relation to the vaccine, Michael at WTMJ is asking if we're concerned with all this vaccine talk, if people are going to start being a little more lax with those good public health practices that we've been talking about. So I feel like you all probably could talk about that. I don't know who wants to tackle that question, but I know we know those are important.
Yeah, and I'll handle that. Thanks. And that's a great question, because I think a lot of folks will think, hey, I got my vaccine, so I don't need to mask anymore. And that's simply not true. We know that we're in the long haul here with our public health measures, and it's going to be a long time before we have everyone vaccinated who wants a vaccine. So we're going to strongly encourage the general public and insist on our team members, clinicians, et cetera, to continue to mask and use PPE and public health precautions.
Yeah, and to add on to what Dr. Stuck just said, there's a very specific reason why we need to do this. We know the vaccine prevents sickness and severe illness in people who get it. What we don't know is if it prevents acquisition of the virus. So the virus is floating around, you're exposed to it, you could easily become colonized with the virus in your nose. If you've got the vaccine, you may not get sick from the virus, but you can still pass it to other people, which is why it's so important to maintain masking and social distancing. We expect these measures to be in place for the next several months, and really until we achieve an adequate level of herd immunity in our population.
And if I could just add to what Dr. Citronberg and Dr. Stock also mentioned, even though our focus in recent months has been on COVID-19, we also have to remember that this is influenza season. Most of the measures that we've talked about with masking, hand hygiene, social distancing also help to reduce the spread of influenza. And those are additional things that I think we need to worry about as a community, which will also help reduce the rates of hospitalizations related to respiratory illness in the coming months.
Thank you, guys. Our next question is also vaccine related, and it's from Lauren Anderson at the Milwaukee Biz-Times. She's asking what our plan is for vaccination for our employees, who will be prioritized, and how long do we expect that process to take?
I can start with that. We have been working on a prioritization strategy that prioritizes people who are most at risk for contracting COVID infection. And those are people who work in patient care areas where COVID is present. So emergency departments, ICUs, COVID units. And even within those units, we are trying to identify people within those units at the highest risk, the people spending the most time with those patients. And so we have a prioritization schedule. We are hopeful that when we get an adequate supply of vaccine, we'll be able to immunize all of our frontline healthcare workers. We realize that the supplies probably through December will not be enough to immunize everyone. I want to make this point. Immunization is an urgency. It's not an emergency. And it's very important to maintain an orderly process around immunization of our team members to make sure we identify the right people who need the vaccine and then to go from there. But we expect that hopefully in the next 4 or 6 weeks, we should be able to immunize all of our patient-facing team members who want to get a vaccine.
Thanks, Dr. Citronberg. The next question is also related to vaccines, but this is related to cold storage. Madeline Buckley from Chicago Tribune is asking, does every hospital have cold storage? And what is the process for getting cold storage space for our sites?
I guess I can take that. We are prepared throughout our system with super cold freezers to be able to handle any any vaccine that comes in frozen. So we are prepared. We have adequate space within our sites and freezers throughout our system to do that. I guess what's also important to note is that the Pfizer vaccine, which will be the first vaccine to come out, is the only one that requires super cold storage. Every other vaccine that comes out after the Pfizer vaccine will not have that same requirement. So the need to keep vaccines frozen is really limited to one vaccine at this time. The rest can be maintained in usual and regular freezers and refrigerators.
Thank you. We're going to move away from vaccines for a moment. Sean Kirkby from Wisconsin Health News is asking if we've seen a spike in cases since Thanksgiving, and what do we think is behind the apparent drop in cases last week? I know that Dr. Stuck, you touched on that a little bit in the beginning, but could you maybe expound on that a little bit more?
Sure. Thanks for the question. We are pleasantly surprised that our numbers have been down a little bit for the last 2 weeks, but we are bracing for another spike. We know that that when folks gather for celebrations and holidays, that there is a spread for us. So we are concerned about the next few days and weeks, and especially as we get into the holidays around Christmas, Kwanzaa, New Year's, etc. We are just absolutely imploring the public to not gather together and to celebrate virtually. Again, we know this is very difficult, but we know that's the only way that we can stem this tide and keep the pressure off of our inpatients.
Thanks, Dr. Stuck. Another one from Sean that we have is about staffing. He was asking if we're getting help from HHS and the Department of Defense. Maybe Dr. Iroegbu or Dr. Stuck, can you address that and maybe staffing more in generally about how we're handling that?
Sure. So we are strained with staffing, but we are handling it. And that's why, again, we need everyone to help us to limit those social gatherings so that we don't get more inpatients. As Dr. Citronberg said, nationally, we are seeing a rise in cases, and so we are concerned that it's going to impact us further. We are pulling out all the stops for getting all the help that we can. We have redeployed team members across the state line. We've moved folks from our ambulatory clinics. We've cut back on some of our elective procedures, trying to manage that. And I think that's one of the advantages of being a large integrated delivery system across 2 states, that we are able to move staff, ventilators, PPE, et cetera, around. So we feel that we're positioned well, but this is hard. There's no question about it.
Thanks, Dr. Stuck. The next question we have is also from Sean and not related to vaccines. This one's about community testing and where we're standing on that. I know, Dr. Stuck, you can maybe talk a little bit about that as well.
Sure. We are performing about 4,000 tests a day in community testing. This is a great increase over the spring, and we're very excited about that. That being said, there is a finite amount of testing that we can do, and with the current surge and the high levels of inpatients, we have to prioritize our testing to inpatient at this time.
Thank you. Going back to the vaccine for a little bit, we did have Jake from the Daily Herald ask about kids and vaccine trials. And he's asking how many kids would have to be in a trial, what would the age groups look like, gender requirements, and why is it important to have children in trials and not just adults? Dr. Citronberg, do you think you could talk about that a little bit?
Sure. You know, we don't have a ton of information because some of that is proprietary and maintained by the manufacturers of vaccines. What we do know is that both Pfizer and Moderna are studying the vaccine right now in kids 12 and older. And we anticipate, if the studies look good, that sometime next year, maybe even early in the first quarter, perhaps, we'll have approval for children 12 and older. We do not believe that kids under 12 are being studied right now for the vaccine. It's actually important to note that younger children actually are much less contagious than older children or adults. So the real focus is on those people who are most potentially most contagious, which are adults and older kids. But hopefully we'll have some good information about children 12 and up early next year.
Great. And on the same topic of vaccines, Becky at WBZ is asking, have we reviewed the Pfizer trial data? And what do we think about the technology that's being used by the 2 leading vaccines?
Yeah, we have reviewed it. The FDA released the Pfizer data a couple of days ago. It's a very comprehensive document. We've reviewed it. First, as far as the technology, mRNA technology is quite amazing. It's been known about for a long time. It's the first time it's been used in a human vaccine. Basically, the mRNA triggers your cells to make a spike protein, and then when you make the spike protein, your immune system makes antibodies against the spike protein. So basically, your body is making antibodies against the spike protein without ever having seen the virus. It's a really fascinating technology that can not only be used for vaccines, but also for treatment of cancer and other things down the line. The data that we reviewed looks excellent. The efficacy data is, as was quoted, about 94 to 95% effective in preventing COVID-19 infection and illness. There were side effects reported as expected. We want there to be side effects. The side effects means that your immune system is responding to the vaccine. So things like fever, muscle aches, chills, sore arm, fatigue that is transient, those are all good signs. There were no serious safety concerns that were reported within that trial. And on balance, this is a really, really favorable report on the efficacy and the safety. There is no doubt that the benefit of this vaccine far outweighs the risk.
Thank you. We have another couple questions from Alex, who is asking, what has it been like working through the pandemic and seeing people claim it is a hoax or ignore the direction of health officials entirely? With people skeptical of the vaccine, what do you have to say to these folks to reassure them that it's safe? And I feel like each of you could maybe talk a little bit about that, because I know you probably all have your own unique experiences.
Sure. Leanne, maybe I'll start us off. I think it is difficult, and we have to acknowledge that the general public is getting mixed messages for either economic or political reasons, et cetera. And we acknowledge that it is confusing for the general public. I think we would really like to message that we know this pandemic is real. The virus is deadly, as Dr. Citronberg pointed out, nationally. This is disastrous, the number of patients who are becoming sick and dying. And I believe that our frontline workers who are so resilient through this, but are stressed by the marathon that we're in this war against this virus, they would want everyone to know that this is real and to please follow those social distancing, masking, and other public health measures.
And if I could add to that as well, you know, I interact with a lot of frontline staff, and I see the anxieties that many of them face, not just about perhaps potentially contracting the illness, but also what this means for their day-to-day work. Many have had to make very tough decisions around life or death for patients who contract COVID-19 multiple times a day. The unknowns about the virus add to the stress because in some situations you have patients who, despite all aggressive medical interventions, continue to decline and sometimes pass away. You look at our bedside nurses and nursing assistants, they've often been called to be conduits for patients whose families are unable to come in to assist with video calls. Those are very traumatizing situations, and the frequency of it adds to the stress and the trauma that our frontline staff deal with. So I do understand, because they are also members of the community, what they face when they go back out into the community. And like Dr. Stock mentioned, there's been a lot of mixed messaging, and I think the community obviously is concerned about what is factual and what is not. But we can say, based on what we see, that this is real. And the challenges that patients and their families, as well as the frontline staff face, are real. And I think the only way that we can help each other and support one another through this is to follow those public health measures that we've all talked about. You know, really, I think over time we'll get through this. The vaccines are one very important step, but it's also essential that we continue to support one another by wearing masks, social distancing, following through with hand hygiene, and all the other things that we've talked about. It's very helpful for those who are at the front line, because over time, the stress of this is going to wear them down even further.
Yeah, those are very sobering messages, and I'll add, it's really hard. It's almost unimaginable that people at this day still think that this is a hoax or this is not real. There's almost no one in this entire country who's not been affected by this, by a family member, a friend. And people who choose not to wear masks, they, to some extent, are risking their own health, but much more risking the health of others around them, their family members, colleagues, people that they interact with. And it's very hard to explain why this is happening, but it is very real. And I'll tell you that I have witnessed this myself and heard from colleagues throughout our healthcare system and all over the country about the number of patients who are taking their last breath before they get put on a ventilator, before they die, and say, you know, I wish I had taken this more seriously. I wish I believed in this. Now I know it's real. And that's an incredibly sobering message that has is very traumatizing to our staff. And you know, the message I send to all the people who don't believe in it, if you show up sick with COVID on our doorstep, we're still going to take care of you like we take care of everybody else. But we just wish that people would be more considerate and take this seriously.
Thank you all for sharing those thoughts on that. We appreciate it. One more question, final question from WBBM. Are we mandating the vaccine, and how are team members feeling about it?
You know, at this time, we do not have any plans to mandate the vaccine for our team members. The vaccine that should be released today under emergency use authorization, while it's been studied for a few months, we don't have enough data about any long-term effects about it. And we think as a system, a more prudent approach is to encourage the vaccine among our team members. And we are, by the way, very optimistic that the vast majority of our team members will take the vaccine over the next few months. So we don't feel like we have enough information to mandate it. We also don't think that's the right strategy right now. Encouragement, education are the ways to get people to take the vaccine. Now, down the line, in subsequent months, that policy may change, but right now we don't have any plans to mandate, but we do have plans to strongly encourage the vaccine for our team members.
Thank you, Dr. Citronberg. With these last few minutes here, because we got to kind of have a hard cutoff here at 8:45, I wanted to give you guys each just a final chance to share your final thoughts, whether it's reiterating any messages that you've already shared. And maybe we just go down the line in the order that we began. And Dr. Stuck, if you could just kick us off with maybe some final words.
Sure. Thanks for the time today. I'd first like to say, think of masking as showing that you care for others. This is a way of showing that you really do care about your family, your coworkers, and the general public, and that you're doing your part to help out. So encourage others to wear masks and show that you care by wearing a mask. As Dr. Citronberg said, vaccination is the way out of this pandemic, and we are excited about the next few days and weeks as we are able to launch this and partner in disseminating the vaccine. So please look at that as a positive and encourage folks to take the vaccine. And lastly, we acknowledge this is very difficult. We know this is hard and it's fatiguing for the general public and it's fatiguing for our doctors and nurses. But let's all work on this together. We will get through this. There is light at the end of the tunnel. Thanks.
Thanks, Dr. Stuck. Dr. Iroegbu?
I just want to echo what Dr. Stock said, but also to remind the community that to be able to make this happen and care for the number of COVID patients we've had, we have had to scale back on so many other services that we provide to the community. There's a reason why patients require elective surgeries. To scale back on an elective surgery sometimes means that someone is not getting the care they need in a timely manner. So one of the other things that they can help us with is to adhere to those public health measures, because it allows us to get back to doing what we do, providing care for our community.
Thanks, Dr. Iroegbu. And Dr. Citronberg?
This is the greatest public health challenge in all of our lifetimes, and it's probably the greatest public health challenge worldwide. It certainly is since 1918, 102 years ago, the Spanish flu pandemic. We have an opportunity to get out of this pandemic, and that is by mass vaccination. And to look at it the other way, how do we get out of this pandemic without mass vaccination? And we don't. Without a vaccine, we would expect at least another 2 or 3 years of this pandemic, which the cost would be hundreds of thousands of lives and continued economic despair. We have a ticket out of this pandemic, and it's going to be so important for everyone in the community to get together to participate in mass vaccination so that we can end it. The good news is, if we can get everyone vaccinated who needs to be vaccinated by the end of June, the second half of next year looks very promising. Things that we've all missed, sporting events, concerts, gatherings, we will start to see those all come back the second half of next year, but that's entirely dependent on successful mass vaccination.
Thank you, Dr. Citronberg, and thank you all for joining us today. I know that Brett and Madeline, you kind of have some questions there in the chat, and we will try to address those. I just don't think we'll have time right now to do it because I know our doctors need to get going. So thank you, everyone. If you have any follow-up questions, please feel free to email us, mediarelations@aah.org. Again, that's mediarelations@aah.org, and we'll try to get back to you as soon as we possibly can. I'm sorry we couldn't get to everything. I know we just had a limited window of time today, but thank you everyone for coming, and wear a mask. Have a great day.
Thank you.
Thank you.